So we are linking the IVF registry to this National Health Data Hub and also perinatal datasets in multiple jurisdictions. And my role is to establish this data platform and make it available for future researchers to come and answer their important clinical questions using this database. My name is Erandi Hewawasam. I am currently working in the National Perinatal Epidemiology and Statistics Unit within the Centre for Big Data Research at the University of New South Wales. I moved to Australia from Sri Lanka when I was with my family when I was 14 years of age. I did my high school here, back in Adelaide. And I've always had an interest in the medicine field. And so I started off with a Bachelor of Medical Science. This was a core badge degree between University of South Australia and the Australian National University in Canberra. And this really opened my eyes to a whole new area, which is the medical research field. And I enjoyed sort of seeing all the different fields within the medical research field, for example, immunology, genetics, pregnancy, reproductive medicine, and so on. And after completing this Bachelor of Medical Sciences, I sort of wanted to continue to explore that research field. So I did an honours here. I went to Australian National University again for 1 year and did an honours looking at microRNAs, which are the non-coding parts of RNAs, expression in obese pregnant women. So basically what I did was went to the birthing suites and collected people's placentas and extracted the trophoblast cells, which are the placental cells, cultured them in the lab, exposed these cells into to sort of high sugar, high fat environments, and look at the microRNA expression. This was a really lab-based project that I did for my honours in collaboration with the Canberra Hospital Endocrinology Department. After doing this honours year, I wanted to continue down the research pathway, so I went back to Adelaide and the South Australian Health and Medical Research Institute and started a PhD there. My PhD project had two components. One was a clinical component, the other was a lab component. In the lab component, I developed a new method for measuring long-chain omega-3 polyunsaturated fatty acids. We commonly call them fish oils, and basically measuring them from a dried blood spot. And I used my new method that I developed to measure a whole range of blood spots collected from preterm born babies. And in my clinical component, I looked at the neurodevelopmental outcomes of preterm born children and who were given fish oil supplements at birth or a placebo. And after my PhD, I did my postdoctoral research fellow position at the South Australian Health and Medical Research Institute at the Australia and New Zealand Dialysis and Transplant Registry. This was a completely new experience for me. I feel like this was a career change and a career turning point, because coming from a sort of a lab, clinical, sort of roles into epidemiology and data sort of field. So I had to learn a lot in this role, but it was a great learning curve for me. I worked on a landmark large linked data set involving 4 states, South Australia, New South Wales, Australian Capital Territory, and Western Australia, where we had perinatal data sets and over 3 million babies born, and we looked at kidney disease people living with dialysis and transplant, and their outcomes for the mums and their babies. So I feel like this was a big career change, career turning point, but I was able to use a lot of the transferable skills that I learned during my honours and my PhD and apply it into this role at SAMRI. After that, I decided to move to New South Wales more for personal reasons, and I took my current position, which is a research fellow at the Centre for Big Data Research. And this was a big step up for me because I am now the program manager for a Medical Research Future Fund funded large data linkage project. In my current role, I wear a number of hats. I am the program manager for a project called FM Data Platform, which is the Fertility Medicine Data Asset for Australia, which is funded by an MRFF grant, which is the Medical Research Future Fund infrastructure grant. And this is to establish a large linked data platform with the Australia and New Zealand assisted reproduction database linked to the National Health Data Hub that is hosted at AIHW, which is the Australian Institute of Health and Welfare. And it includes data like hospital data, Medicare, pharmacy, cancer registry data, ICU data, and many other data sets. So we are linking the IVF registry to this National Health Data Hub and also perinatal data sets in multiple jurisdictions. And my role is to establish this data platform and make it available for future researchers to come and answer their important clinical questions using this database. I also wear the project manager hat for another established data linkage platform already available. So it's called the Early Life Course platform, and that is just New South Wales wide, and it involves about 20 linked data assets. And that is the perinatal data sets, hospital data, Medicare, pharmacy data, and also it includes some educational data sets like the NAPLAN data. So it's such a valuable data asset, and lots of researchers at the moment are doing multiple different research projects using that platform. With my research fellow hat, I am currently doing two main projects. My research area is looking at chronic conditions and things like endometriosis, for example, and chronic kidney disease and its impact on pathways into pregnancy for people and outcomes for these mothers and their babies, and with a particular interest in IVF and outcomes, IVF treatment effectiveness and outcomes. I collaborate with many organizations across Australia, New Zealand, Pacific, and also internationally. In particular, I collaborate with organizations and clinicians, researchers, and various patient groups from organizations like the University of Adelaide, South Australian Health and Medical Research Institute, Monash University, University of Western Australia, Sydney University, and so on. I also collaborate with researchers, students, and clinicians from countries like UK, USA, and Netherlands on various international projects. And a lot of these collaborations for me have started from various national leadership roles that I have held. For example, I am currently the Secretary of the Developmental Origins of Health and Disease Australia, New Zealand and Pacific, and I was the former Deputy Chair of the Australia and New Zealand Dialysis and Transplant Registry's Parenthood Working Group, and I was able to drive some of the new initiatives as well as capacity building in these roles. And I have also built strong partnerships with organizations, government organizations, like the New South Wales Ministry of Health, and large sort of infrastructure organisations like the AIHW, Australian Institute of Health and Welfare, various data custodians, data linkage units, and various ethics committees across multiple states. And this was to support complex data linkage studies and governance processes. My work is funded through a few different grants. Currently, I have a Society of Obstetric Medicine Australia and New Zealand research grant that is supporting me to do research looking at kidney disease in pregnancy and how it influences IVF treatment effectiveness and pregnancy outcomes for mothers and their babies. I'm also funded by the Kidney Transplantation Diabetes Research Australia grant. This is to look at an immunosuppression medication called tacrolimus levels in pregnancy in women with kidney transplants and immunological kidney conditions, looking at a new method for measuring these levels in pregnancy compared to the standard method. And this will ultimately help us with the dosing and measuring these levels in pregnancy properly. My work that I'm involved in with the FM data platform, which is the Fertility Medicine Data Asset for Australia platform, is funded by an MRFF grant that is awarded to the staff at the Centre for Big Data Research in Health. My previous work was funded by the Hospital Research Foundation in South Australia, a Women's Health Translation Research Network Award, and some other NHMRC funding as well. For me, the passion comes from two different areas. One is by working with patients in the work that I'm doing. So I work with the National Consumer Advisory Group. These are women and men with kidney disease who have experienced parenthood journeys. And seeing the real-world impact that my work is having on their lives drives me in my work that I'm doing every day. But in particular, when we have these meetings with these consumer groups, we celebrate people's milestones. For example, their 10-year anniversary from their kidney transplant date. Or sometimes these women bring their newborn babies, and that gives me so much joy in my work to see the real-world impact. The second aspect of my passion really comes from the education that I'm doing, whether it's lecturing students, whether it's through STEM sessions that I do with high school girls. Some are from low socioeconomic backgrounds. And it gives so much joy, particularly after a session, to see their smiles. And that's one of the most rewarding part of my job. Outside of work, I love spending my time with my 4-year-old son in particular. He keeps me very busy and active. And we love going to, whether it's going down to the beach or whether it's, going to a holiday house a couple of hours away, or interstate or internationally. I love spending time. I love traveling with my family. So that's what I love to do.